Welcome back to the Healing Wellness Show. I'm your host, Dr. Cream. Joining me today again, Amanda, nurse practitioner at Iowa Wellness Center. Thanks for coming today, Amanda.
Thank you.
Today, we're going to be talking about one of the most underrated tools in healthcare, which I think you mentioned on the last show, blood work.
Correct.
So what if the answer to your fatigue, your mood swings, your inflammation were already in your body waiting to be revealed? So we're going to be answering these questions here for you. I'm just going to be asking Amanda some of the questions that patients have asked us in the past and kind of have you as the expert tell us what's going on with them.
Sounds good.
Amanda, if you just want to just briefly, I know if someone hasn't heard our last show, just kind of give us an intro about yourself.
Yeah, so like he said, I'm Amanda. I'm the nurse practitioner here at Iowa Wellness. My background is primarily in cardiology. I've been here with Iowa Wellness for about 5 years now and just expanding our practice into that functional integrative network, which has really helped our patients grow and enhance their quality of life. Actually working on my functional medicine certification now, so learning some more tools to add more knowledge to share to my patients. So it's been an awesome journey.
So today we're just going to be talking about something that seems very simple, which is your blood. As you mentioned, it's very powerful. So why do you use that at Iowa Wellness Center?
Yeah, so I think first and foremost, listening to my patients and kind of figuring out what their goals are, and kind of, what they're coming to me about is important. So listening, kind of putting on their timeline of events, what has happened in their whole lifespan, quite frankly. And then obviously getting a blood panel, and I draw a pretty extensive panel. What I like about it is I can pretty much change it or alter it based on what the patient's needs are, what I feel like they might be more at risk for as I learn about their history. So I have the power to pretty much check anything and everything that I feel might be relevant to, getting them to where they need to be.
So what kind of information can you get from a simple blood?
Yeah, so, honestly, you can get, again, pretty much anything and everything you want to know from, how's their thyroid functioning to how much inflammation is in their body, what vitamins or minerals they're deficient in, are they at risk for cardiac events, kidney, liver, you name it, genetics, mold or heavy metal toxicities. We really can test for, and it gives us a lot of good information good starting points.
So what are some common conditions or imbalances?
So, there are so many, but I would say catching, anemias or hypothyroidism or inflammation. Obviously, hormones is a big one. Like I said, vitamin, mineral deficiencies. There's just so many that I see day in and day out, and they're usually most of the time very easy to correct.
So there's a lot of different panels out there, correct? So can you break down some of the most important blood tests that you typically will run on patients?
Yeah, so I do a complete blood count and a complete metabolic panel, which assesses, blood counts, electrolytes, kidney function, liver function. That's pretty much standard, I would say, a routine lab that most of your providers are going to check. I do an extensive thyroid panel. So a lot of the time my patient comes in with, I have a TSH. Well, that's not really a reflection of your thyroid. So I delve into the thyroid. What's the reverse T3? What's the free T3? What's the free T4? Do you have antibodies that are attacking your thyroid gland? There's way more to the picture, as Hashimoto's is the number one cause of hypothyroidism. So I catch a lot of those, actually. Inflammatory markers. I specifically look at the high sensitivity CRP, which is specific to the heart. And I'm able to find those patients that are more at risk for cardiovascular events, which is our number one cause of death still. And these patients have no idea that they have this elevation in this level. So it's pretty astounding to be able to not only educate them, but tell them what I can do to correct that. I look at, iron storages, because you can't fix the thyroid until your iron levels are optimized. I look at vitamin D, vitamin B. I look at more extensive lipid panels. So yeah, you have your cholesterol, your HDLs, LDLs. I actually am also incorporating in what's now called an LP little a. It's actually a genetic mutation that's found in about 20% of the population. And it's, again, shows that these patients that have this genetic variant or polymorphism is at increased risk for stroke, heart disease, heart attack, which is quite a significant group of people. So that's just some. And then obviously I check testosterone, estrogen levels, sex hormone binding globulin, which is important to know when you're dealing with hormones. So that's the majority of what I draw. Of course, if a patient comes in with other needs, I can draw pretty much anything and everything. I have a lot of patients with mold exposure, Lyme's disease, questions about, inflammation markers. So I can always add those in as needed too.
So just to follow up, you said, like, for example, thyroid, you do pretty extensive labs on it. If a patient comes in and says, hey, I've got my own labs, whether for testosterone or thyroid, or is that sufficient enough for you?
So most of the time, no. A lot of the times patients come in with the standard routine labs that their doctors check every year. And I go just a lot further, a lot more, beyond that. Like I said, my patients are sitting in front of me symptomatic and they're told that their TSH is in normal range. Well, that means nothing to me. So what's your free T3? That's the active form of your thyroid. So until we have a optimized free T3, the patient's going to be miserable. And these doctors they don't check them. So I look at them. It's nice to have something to compare to, I guess. But no, I dive a lot deeper into my lab panel, which I think is an absolute must.
So are these tests just for like sick or symptomatic patients, or do you also do it for healthy people?
No, everyone, anyone and everyone. It's like I said, most of these people have never even heard of these labs, never even, obviously had these labs checked. And until you do, you'd have no idea, where you're sitting. There's some family genetic components to some of these. So, and like I said, genetics, variants. So they're necessary for everyone regardless.
So how does the blood work help you personalize a plan for a patient?
Yeah, so I think it just gives me an idea of where to start. If they're coming in and they have red flags everywhere, and it's just overwhelming, I can kind of pick where I need to start and go from there. What nutraceutical do I need to add? Do they need hormones? Do they need a GLP, which that'll be another podcast that we can go into depth about is the GLPs and kind of what we're doing for patients with those. But it's, incorporating certain things. I don't like to change too many things at once. We can tweak little things and then kind of follow the patient, see how they're feeling, see how they're doing, work on gut health, which is another important component to all of this. So it just kind of gives me an idea of where to start. And also, what are the patient's goals? What's their number one thing that they're most concerned about? And so then we can start there and go from there.
So we just did a podcast on bioidentical hormone therapy.
Mm-hmm.
So if you guys haven't seen it, go back and look at that. But how critical is lab to manage hormone therapy?
Yeah, we have to have it. Like I said, it's important that we keep those therapeutic safe target ranges. So I'm constantly checking trough levels or, if a patient's symptomatic, checking level at any time. But yeah, the labs are very important as well as the patient's symptomatology.
So what are some common misconceptions about blood work?
Yeah. So like I mentioned, a lot of patients just come in and say, "Oh, I'm normal." They have this concept that if their level is sitting in that reference range, that they are normal. That's the end all be all kind of thing. And so when I tell them that, this is bad or that's bad, they'll say, well, I'm in the normal range. Well, again, that's where the education piece comes in, kind of like what I talked about previously. So I do a lot of education, and these patients are very much appreciative of that because, they're not told these things.
How often should someone get lab works done?
If they're doing pellets with me, they're probably getting they're probably getting labs at least every 6 months. It just depends on what we're doing. If I'm adjusting thyroid medications, I'm going to check your levels again in 8 to 12 weeks. If I'm putting you on a vitamin D supplement or any supplement, I'm going to check your levels in about 3 months. So it's just a matter of what I'm adjusting or what I'm adding to their plan. But yeah, I think it's always good if you're going to treat your patient in some way, you need to follow up and make sure what you're doing is sufficient and, benefiting them.
So can you share a real example, of course, no names, HIPAA, of a time when lab work helped you uncover something important and allowed you to help a patient in a very big way?
Yeah. So like you had previously mentioned, I caught a patient who had a very elevated PSA. It turns out he did have prostate cancer. Through the workup for the prostate cancer, he found out that he had significant coronary artery disease and actually had to undergo open heart surgery. So all of these things kind of dominoed, and now he's thriving, and he would have never known he had prostate cancer, let alone was at risk for a major heart attack too. So one thing kind of led to the other, and now he's doing excellent. He comes into our clinic at least twice a week, and he's doing well. He's in remission actually, so that's pretty cool. The other one I can think of that I caught is a patient with polycythemia vera, which is actually essentially a type of blood cancer. Your bone marrow is producing too much of these cells, and so these are just some of the things that I look at, and I'm not going to pellet someone until these things have been ruled out or under control. Sleep apnea is a big one that I catch that patients are unaware of, which, like hypertension, is kind of a silent killer. So finding these patients, identify these patients, again, providing education, and then, like I said, it's making sure that these patients are safe to give hormones to, and making sure that we're ruling all of these things out, so that the patients can be healthy and happy, and working in collaboration with their specialists and other doctors helps too, so that we're kind of all on the same page, and all our goal is to help the patient.
So what would you say is one thing that you would want our listeners today to walk away with about the importance of blood work?
I would say, if you're being told that, your levels are in normal range and you're not feeling well, just know that, there's a reason for that. So don't just take that as your answer, right? Be an advocate for yourself, ask the question why, and then find someone like me who will find that why for you. I don't care how long it takes. We got to find that root cause. We got to figure out why your body is presenting the way it is. So blood work is a great tool, but it's not the end all be all. And just know, go to someone who actually has, an idea of what these labs truly mean, and what, optimal is.
Well, thank you, Amanda, for sharing again,
Thanks for
knowledge
having
and
me.
wisdom again on us. We're definitely going to do more of these podcast shows. I think you talked about maybe GLP or gut health. So I think we'll book these and do more. I think the audience are loving all these, with all the high fives and thumbs up that we're getting.
Absolutely.
So yeah.
Keep them coming.
Yeah. So thank you, Amanda, again. So again, thank you again for joining us on the Healing Wellness Show. And you don't have to wait for a diagnosis to start paying attention. Your body is talking to you, and blood work might be what is listening. So schedule your labs today. If you want to get a hold of Amanda, it's Iowa Wellness Center. You'll have her contact info on the screen. Just book an appointment. I think you said free consult.
Absolutely.
That you can get in with her, and that way, you get the guesswork out of your wellness journey. And so again, thank you for joining us on the Healing Wellness Show. I'm Dr. Kareem, and stay tuned for next show.